In an average night of sleep, we need about 7 to 8 hours. It's somewhat variable from person to person. But the reality is most of us are not getting enough sleep. The majority of us are getting less than 6 hours of sleep a night. And this can cause a lot of difficulty with our lives and lead to a lot of different health conditions. We know that if you're chronically sleep deprived and not getting good quality and quantity of sleep, that you could be at risk for mood disorders like depression and anxiety. And if those are left untreated and if your sleep problem is under-recognized, then you can continue to have difficulty with work and with life and in relationships. There are several strategies that we recommend for improving your sleep. One of the most important things is having good sleep habits or sleep hygiene. If you can pick the same bedtime every night and pick the same wake-up time every morning, just doing those two things can really be helpful. Common symptoms of sleep apnea include daytime sleepiness, poor sleep quality. Snoring often is a warning of sleep apnea. Many times people will have agitation or difficulty with memory and concentration, which could be directly related to their poor sleep quality from sleep apnea. A sleep study, otherwise termed a polysomnography or a nocturnal polysomnography, which means a nighttime multiple graph of your sleep. It's a study, it's a medical procedure that helps us understand your sleep better. We record your sleep with multiple electrodes on different parts of your body to understand the physiology and what's happening while you're asleep. There are many different treatment strategies for sleep disorders. It's important that you meet with your physician or a sleep specialist to have a good understanding of what exactly is affecting your difficulty with sleeping. If it is identified that you have a problem with breathing during your sleep, we can objectively identify that with a sleep study, and then we could put together a treatment plan, typically with a positive airway pressure to help maintain your airway while you're sleeping. Or sometimes we would use other devices like an oral appliance to help improve your sleep quality and quantity and help your normal airflow occur during sleep. If you think you might have a sleep disorder, if you have difficulty getting to sleep or staying asleep, if you snore loudly or someone's told you stop breathing during your sleep, you should discuss this with your doctor. Untreated sleep disorders can lead to many medical conditions and can cause problems during your everyday life and functioning. Difficulty with your job performance, difficulty with relationships. And it's important because we have many treatments that you may benefit from. If you undergo an evaluation in a sleep disorders clinic, we could better understand your sleep and we can make a big difference in your everyday life. Many people don't consider sleep and sleep problems a medical condition, but there are many medical problems that are directly related to poor sleep quality and not enough sleep. So you should get evaluated and have a better understanding of how to improve your sleep.